Paula, thank you for arranging this very worthwhile program this morning. Thank you for having the police here to welcome me. I thought, oh boy, I'm really important. I have an advance team here. You know, every time I think about this whole issue, I get frustrated, annoyed. I mean, I was chatting with Dr. Pearson over with the table I'm sitting at, and let me backtrack for a moment. We have a wonderful summer intern in our office who lives in Teaneck, goes to school at Brown University, and that's Jeremy Feigenbaum sitting back there. So take good notes, because this is for your future. And that's what these people are all about. And I said he also brought the average age in the room down considerably by being here. Before I talk about the single payer plan, let me just step back for one moment, give you a very brief discussion about another extremely important issue that is being discussed right now in the New Jersey State Legislature, and that is the privatizing of Horizon Blue Cross Blue Shield. As we talk about going into a single payer plan nationally or revising healthcare nationally, in the state there is an application from the state's largest insurer, the health insurer of last resort, to become a private, for-profit stockholder company. So this is an issue about which everyone has to get involved. I have a bill in which has only gotten through committee, has not yet been posted, and that's where I need your help, which at least sets up a framework to make sure that we have public participation in every step of the way of this application from Horizon. That the public advocate's office be involved, that there be at least 4 hearings throughout the state of New Jersey, that there be a health impact study, because the original law, which sets up a framework for privatizing, talks about actuaries, lawyers, and accountants, but there's very little that talks about health impact. So the bill number, I never remember my own bill numbers, unfortunately. The bill number is Senate 2532. And anybody who would like to call Senator Cody's office or drop Senator Cody a line urging him to post this bill for a full vote by the state Senate. Because if we don't get it through the legislature before the application from Horizon is deemed complete, goes through the Department of Banking and Insurance and the Attorney General's office. If the application is deemed complete, then they would have a due process issue that we change the rules after they put their application in. So we're anxious to get this done before the application is deemed complete. I can use your help on that, and there is nothing at this very moment that is more important for the residents of the state of New Jersey than getting a hold of this process before it runs away from us. New York did a horrendous law back in 2002 or 92, I don't remember now, but they did privatize Empire State Blue Cross Blue Shield, and all the money was used that they got out of that the taxpayers got out of that, was used up in 1 year. And that's the end, and they were left with a private company. So when we talk about for-profit health care, this is extremely important. You know, I hearken back to the days of Bill and Hillary Clinton when the issue of a single payer plan was first I guess really debated nationally, and they had all those ads on TV, Harry and Sally, or who?
Harry and Louise.
Harry and Louise, thank you. I needed the younger mind of Paul Eisenman to fill me in on who the other half of the couple were, Harry and Louise. And as we look back over the last 10 or 15 years, we got all the bad stuff that Harry and Louise said we would get without getting any of the good parts. And that's the simple way I look at this. The money that gets siphoned off into the health insurance companies is money that should go into your health care and my health care and Jeremy's health care. And in every other industrialized Western nation has some form of a national health care. It is time. Now, do I have a lot of confidence that I'm going to see it passed in the next 4 years? Absolutely not. We are going to see these incremental steps, and the insurance companies will be taking their piece of the action every step of the way. But on the bright side, we are making the incremental steps, and we are getting a national discussion. I have a Senate resolution in which calls for the Senate, the New Jersey State Senate. And what's the number of that, Jeremy, again?
47.
Senate Resolution 47, which calls for the state Senate to stand up and say, we in New Jersey think HR 676 should be passed. We can't do this on a 50-state basis. First of all, states cannot regulate ERISA plans. Those are the self-funded plans, the largest plans in the United States. We in the state cannot regulate those plans. So doing it state by state is almost irrelevant in my humble opinion. It needs to be a national movement. I know I don't have to sell it to the people in this room, but we've got to keep the pressure on, we've got to keep the heat on. And, I'd just like to say a moment, Dr. Pearson is here. He told me he is 3 years younger than Senator Weinberg. And so he's got many years ahead of him to continue advocating. But he has been all over the place. He's a physician to continually talk about this issue. So help us. I know you all believe in it. And Paula, this is the kind of advocacy that will keep this issue alive, and someday we will see it get passed. It's the right thing to do. It's the right thing to do for our economy. We all know that. So thank you very much. Thanks for being interested and involved, and thank you for arranging this.